Have you heard of the RSV virus? This is not only a strange name but also a great danger to children, especially during the cold season. This virus causes a series of respiratory diseases, and if detected in time, the consequences can be very serious. Let's find out the details to protect your baby. Part 1. What is RSV virus? RSV virus, also known as Respiratory Syncytial Virus, is one of the leading causes of respiratory infections, especially in children. This is a highly contagious virus that mainly affects the upper and lower respiratory tract, causing symptoms ranging from mild to severe. The RSV virus belongs to the Paramyxoviridae family, a group of negative single-stranded RNA viruses. It was first isolated from chimpanzee respiratory secretions in 1956. Since then, the RSV virus has been identified as a public health threat, especially to young children and the elderly, and people with weak immune systems. The RSV virus can infect people of all ages, but severe symptoms often appear in children, especially children under 2 years old, with severe risk in the group under 3 months old. Children are not breastfed for the first 6 months of life, making their immune system weaker. Babies born prematurely or with very low birth weight. Children with congenital diseases such as heart disease, pulmonary hypertension or chronic lung disease, e.g., pulmonary dysplasia. In addition, children living in unhealthy environments such as cramped, damp homes, or regularly exposed to dust and cigarette smoke are also susceptible to serious illness when infected with RSV. RSV virus is one of the main causes of bronchiolitis, viral pneumonia, respiratory complications such as difficulty breathing and respiratory failure. Understanding RSV helps parents prevent, recognize and promptly handle when children show signs of suspected infection. In the next section, we will delve into the mechanism of spread of the RSV virus. Part 2. Mechanism of spread of RSV virus. RSV, Respiratory Syncytial Virus, is mainly transmitted through virus-containing droplets from sick people when they cough, sneeze, or talk. These droplets are large in size and can fall on nearby surfaces or stick to hands and objects. From here, the virus can easily spread to others when they touch their nose, mouth or eyes. Main routes of infection. 1. Through droplets. When an infected person coughs, sneezes or even just talks, the RSV virus spreads through small droplets. These droplets can penetrate directly into the respiratory system of healthy people if at a close distance, less than 2 meters. 2. Through direct contact, touching an infected person, such as shaking hands, or hugging or kissing a child infected with RSV. Children often spread diseases to each other when playing closely or sharing toys. 3. Through virus-infected surfaces or objects, the RSV virus can survive on surfaces such as tables, chairs, toys, doorknobs, and clothing for several hours. If you touch these surfaces and then touch your nose, mouth, or eyes, the virus will have a chance to enter the body. 4. Through mucus or secretions. The virus can be spread through the mucus or secretions of an infected person, such as dirty tissues, or mucus left on the hands. RSV virus has the ability to spread very quickly in the community, especially in environments where there are many young children such as kindergarten. Large families live together. Hospital or clinic, where children are likely to come into contact with other sick people. Time the virus is infectious, patients can spread the virus to others as early as 2 to 8 days after being infected with RSV, even before symptoms appear. Young children and people with weakened immune systems can continue to shed the virus for 3 to 4 weeks, even after symptoms have subsided. Characteristics of strong spread in children. Weak immune system. Young children, especially under 6 months old, have an underdeveloped immune system, making them susceptible to viruses that invade and multiply rapidly. Contact habits: children often put their hands in their mouths, hold toys, or have close contact with friends and adults. This is the ideal condition for the virus to spread. Crowded environment: kindergartens or play areas often have many children gathered together, creating a highly infectious environment. Understanding how the RSV virus spreads is key to taking effective prevention measures. In the next section, we will discuss in detail ways to protect children and families from RSV. Part 3: Impact of RSV on health. How does RSV affect the body? RSV, Respiratory Syncytial Virus, mainly attacks the respiratory system, especially the upper and lower airways, including the nose, throat, trachea, bronchi and lungs. When the virus enters the body through the nose or mouth, it begins to multiply in the cells of the respiratory lining, causing inflammation and swelling. Depending on age, immunity, and medical history, RSV can cause symptoms ranging from mild to severe. 1. Common symptoms of RSV. Symptoms of RSV vary depending on the subject, often divided into two main groups: mild symptoms and severe symptoms. Mild symptoms, common in adults and older children: stuffy or runny nose. It is an initial sign when the virus begins to cause inflammation of the nasal mucosa. Mild cough, usually a dry cough, which can last more than a week. Sneezing and sore throat, accompanied by a feeling of dryness or itching in the throat. Mild fever, temperature usually ranges from 37.5 to 38.5 degrees Celsius, especially in the early stages of the disease. Fatigue and loss of appetite, the patient may feel weak or not want to eat or drink. Severe symptoms, common in infants, young children and people with weak immune systems: rapid breathing or difficulty breathing. Viruses can cause inflammation and narrow the airways, causing the child to breathe quickly, have a constricted chest or wheeze. Deep and persistent cough, the cough may become more severe, accompanied by a wheezing sound when exhaling. Respiratory failure, symptoms include cyanosis of the lips and fingertips and shallow breathing. This is a dangerous condition and requires immediate medical attention. Prolonged high fever, fever can exceed 39 degrees Celsius, especially when there is a bacterial infection. Temporary cessation of breathing. Babies under 6 weeks old are at risk of stopping breathing for a few seconds because their respiratory system is not fully developed. 2. Dangerous complications of RSV. If not treated promptly, RSV can cause many serious complications, especially in young children and people with underlying medical conditions. Bronchiolitis, it is the most common complication of RSV in children under 2 years old. The virus causes swelling and inflammation of the bronchioles, causing congestion and limiting airflow into the lungs. Children with bronchiolitis often have a severe cough, wheezing, and rapid breathing. Pneumonia. RSV can spread deep into the lungs, causing inflammation of lung tissue and reducing the ability to exchange oxygen. RSV pneumonia is the leading cause of hospitalization in infants and young children during the winter. Apnea. Particularly dangerous in newborns, RSV can cause sudden apnea due to damage to the respiratory control center. Bacterial infection. When the respiratory tract is damaged by RSV, bacteria easily penetrate, causing diseases such as otitis media, sinusitis or blood infection. Increased long-term risk of asthma. Studies show that children who have had severe RSV infection in early life have a high risk of developing asthma or chronic lung diseases in adulthood. 3. Subjects at high risk of RSV infection. Some groups of people are susceptible to severe impacts from RSV, including infants and children under 2 years old, especially children born prematurely or with congenital heart or lung diseases. Elderly people, people over 65 years old, especially if they have chronic diseases such as COPD, heart failure or diabetes. People with weakened immune systems, this includes people who are undergoing chemotherapy, taking immunosuppressive drugs, or have HIV/AIDS. People with a history of asthma or chronic obstructive pulmonary disease, COPD, these diseases increase the risk of more serious infections when infected with RSV. 4. Economic and medical burden from RSV. High treatment costs. RSV is a common cause of hospitalization in infants and young children, causing significant costs to families and the health system. Pressure on hospitals. During RSV season, usually from late fall to early spring, pediatric and respiratory departments at hospitals are often overloaded. Family psychological effects. Caring for children with severe RSV makes parents tired, worried and reduces work productivity. Understanding the impact of RSV not only helps with early detection and treatment, but also emphasizes the importance of prevention to protect the health of children and the community. In the next section, we will discuss the most effective disease prevention measures. Part 4, Effective RSV Prevention Measures. 1. Maintain good personal hygiene. Wash your hands regularly and properly. Wash your hands with soap and clean water for at least 20 seconds, especially before eating. After coughing, sneezing or blowing your nose. After touching toys, doorknobs, or frequently touched surfaces. In case clean water is not available, use hand sanitizer containing at least 60% alcohol. Avoid touching your face. The RSV virus can enter through the eyes, nose, and mouth when hands are contaminated. Therefore, avoid touching your face with your hands, especially if you have not washed them. Use a tissue when coughing or sneezing. When coughing or sneezing, cover your mouth and nose with a tissue and immediately throw it in the trash after use. If you don't have a tissue, cough or sneeze into your elbow, don't cover your mouth with your hand. 2. Clean and disinfect the living environment. Clean frequently touched surfaces. The RSV virus can live on surfaces such as tables, chairs, doorknobs, toys or phones for many hours. Use a disinfectant solution or alcohol wipe to clean these areas daily. Wash children's toys and items. Especially for young children, wash toys, blankets, or items that children often come into contact with to reduce the risk of infection. Keep living space airy. Make sure the indoor space has good air circulation. Avoid exposing children to damp or polluted environments. 3. Avoid contact with sources of infection. Avoid bringing young children to crowded places. During RSV peak season, usually November to March, avoid taking your child to hospitals, daycares, shopping malls, or crowded areas. Avoid close contact with people showing signs of illness. People with a cough, runny nose or fever should avoid contact with young children or the elderly. If someone in your home has RSV, separate the sick person, use a mask, and wash your hands after providing care. Do not smoke near children. Cigarette smoke reduces the resistance of the respiratory tract, making children more susceptible to illness. 4. Enhance resistance. Ensure proper nutrition. A diet rich in vitamins A, C, D, minerals such as zinc and iron helps strengthen the immune system. For infants, breastfeeding is encouraged to provide natural antibodies against disease. Rest and exercise regularly. Adults need enough sleep and regular exercise to maintain a healthy immune system. For children, make sure they get gentle exercise in suitable weather conditions. Vaccination against other diseases. RSV can become more serious if your child has the flu or other respiratory illnesses. Therefore, make sure your child is fully vaccinated, especially against seasonal flu and lung diseases. 5. Use special protective measures for high-risk subjects. Palivizumab antibody drug. This drug is indicated to prevent RSV in premature infants or children with congenital heart disease or chronic lung disease. Palivizumab is not a vaccine, but an artificial antibody that helps protect the body from RSV for a certain period of time. Children need to be vaccinated every month during peak RSV season, usually from October to April. Special care for newborns. Children under 6 months old, especially premature or low birth weight babies, should be avoided as much as possible from contact with sources of infection. Keep children in a clean environment and avoid contact with sick people. 6. Community education and awareness, raising enhanced information about RSV. Parents, teachers, and healthcare workers need to be fully informed about RSV transmission, symptoms, and prevention. Instructions for home care. When children show signs of suspected RSV infection, parents need to know how to identify and care for them properly, including, humidify the air to reduce dry coughs. Have your child drink plenty of water to avoid dehydration. Closely monitor for dangerous signs such as wheezing, difficulty breathing or blue lips, and take your child to the doctor immediately. 7. The role of technology and modern medicine. Follow RSV season. Health organizations can provide information about RSV peak times in each area for people to proactively prevent. New vaccine research. Currently, many studies are focusing on developing RSV vaccines for children and the elderly. In the future, vaccines may become important tools to reduce the burden of disease. Preventing RSV requires a combination of maintaining personal hygiene habits, good health care, and protecting vulnerable people. Implementing these measures not only helps reduce the risk of infection but also contributes to protecting the community and reducing pressure on the health system. Part 5, How to care for children with RSV. RSV, Respiratory Syncytial Virus, often causes symptoms ranging from mild to severe, especially in infants and young children. When children get sick, proper care at home or in the hospital is an important factor to improve their health and avoid complications. Below are specific, detailed steps to care for children with RSV. 1. Monitor and treat symptoms at home. Measure temperature regularly. Use a thermometer to measure your temperature to determine the level of fever. If the temperature is 38.5 degrees Celsius or higher, the child needs to have the fever reduced. Use fever-reducing medications properly. Give your child paracetamol or ibuprofen according to the dosage prescribed by the doctor, appropriate for weight and age. Do not arbitrarily give children aspirin because it can cause dangerous Ray's syndrome. Cooling the child's body. Wipe your body with a warm towel in areas such as the forehead, armpits, and groin to help cool down. Make sure the room is cool and not too cold. Reduce cough and stuffy nose. Respiratory hygiene. Use physiological saline, NaCl 0.9%, nasal drops to clear mucus and reduce nasal congestion. Use a specialized nasal aspirator to gently suck out your baby's mucus, especially before feeding or sleeping. Humidify the air. Use a humidifier or place a basin of water in the room to soothe your child's airways. Limit your child's exposure to air that is too dry or cold. Relieve cough naturally. For children older than 1 year old, you can give them warm water mixed with honey and lemon to soothe their throat. Avoid using over-the-counter cough medicines unless prescribed by your doctor. Maintain enough water for children. Let your child drink enough water. For breastfed babies, increase the number of feedings because breast milk not only provides water but also helps boost immunity. For older children, give more filtered water, diluted fruit juice or electrolyte drinks if the child shows signs of dehydration, dry lips, less urination. Watch for signs of dehydration. Observe your child's urine. If the urine is little or dark yellow, you need to add water immediately. Tired children, sunken eyes, and dry skin are also warning signs of serious dehydration. 2. Limit the condition from getting worse. Proper rest, keeping children at home. Children with RSV need to get plenty of rest and avoid going to school or crowded places to limit the spread and ensure better recovery. Choose a comfortable lying position, place your child on his side or elevate his head with a soft pillow to reduce difficulty breathing and nasal congestion. Avoid irritants. Do not smoke near children. Cigarette smoke makes respiratory infections more serious. Limit exposure to strong chemicals, perfumes, harsh detergents, or dirt can also aggravate your child's symptoms. 3. When do you need to take your child to the hospital? Danger signs: the child wheezes, contracts his chest or his lips turn blue. Breathing faster than normal. Count the child's breathing. If more than 60 times/minute for children under 2 months old, more than 50 times/minute for children 2 to 12 months old, or more than 40 times/minute for children 1 to 5 years old. Children are sleepy and difficult to wake up. Children stop feeding or refuse to eat or drink, leading to the risk of dehydration. Immediate medical examination. When you see your child showing the above signs, take your child to the nearest medical facility for timely examination and treatment by a doctor. Hospital treatments: oxygen breathing. Children with severe difficulty breathing may need oxygen through a mask or nasal cannula. Respiratory support. In severe cases, your child may need breathing support with a CPAP machine or ventilator. Transfusion. If the child cannot eat or drink or shows signs of severe dehydration, the doctor will give fluids to replace fluids and electrolytes. 4. Enhance resistance after recovery. Nutritional supplements. After recovering from the illness, children need to be supplemented with nutritious foods such as green vegetables and fresh fruits rich in vitamin C, oranges, lemons, grapefruit. Protein from meat, fish, eggs, milk to restore the body. Make sure your child eats enough meals. Avoid forcing them to eat if they're still tired. Increase light exercise. As their health gradually recovers, encourage children to participate in gentle activities to improve their health and improve their immune system. Prevent reinfection. After having RSV, children can still get reinfected. Please continue to maintain hygiene measures. Avoid exposing children to sources of infection. 5. Education and psychological support for parents. Reduce anxiety. RSV usually clears up on its own within 1 to 2 weeks with proper care. Reassure your parents, so they don't worry too much. Share full information. Instruct parents to identify severe symptoms, so that they can take their children to the doctor at the right time. Provide detailed and clear documentation on how to care for children at home. Caring for a child with RSV requires patience, caution, and adherence to medical instructions. Early identification of symptoms, proper home care and promptly taking the child to the hospital when there are signs of danger will help minimize the risk of complications and ensure the child's full recovery. The RSV virus can be dangerous, but with knowledge and preparation, we can completely protect children from risks. Please share this video to raise awareness for everyone. Don't forget to like,